The setup costs for Healthier SG are expected to be more than $1 billion over the next 3 to 4 years. An estimated $400 million yearly will also go towards recurrent costs such as health screenings for residents and service fees for family doctors. But Health Minister Ong Ye Kung says that these are investments to reduce suffering later. Sherlyn Sia has more.
Free screenings for diabetes, high blood pressure and high cholesterol, as well as breast, cervical and colorectal cancer. Residents will be able to go for these under the upcoming Healthier SG as part of efforts to have them take charge of their own healthcare. Speaking in Parliament, Mr. Ong says the strategy is a fundamental reform of Singapore's healthcare system to focus on preventive health and not sickness as the country ages rapidly.
Today, our national healthcare expenditure is about $22 billion a year. We are expecting it to almost multiply threefold in the coming 10 years to 60 billion in 2030. So if this national medical bill, instead of tripling, doubled in the next 10 years, we would have saved much more than what we are planning to spend on preventive care.
Residents under Healthier SG will follow customized health plans to stay well. Mr. Ong says it's a big effort to support them, as it's almost human instinct to be tempted by instant gratification.
Eat the fried chicken now. It's very nice. No? Laze around instead of exercising. Binge watch Korean drama instead of having a good night's sleep. Now, all this instant gratification. Everyone's smiling. We're all guilty. Nothing bad will happen immediately or next day, but they accumulate to cause serious diseases or can aggravate existing illnesses later. And by then, it will be a big burden. It can cost us our organs, our limbs, our minds, our lives.
Right now, about 6% of Singapore's healthcare budget is spent on preventive care every year, such as funding the Health Promotion Board. Mr. Ong says the government plans to double this share in the coming years.
And primary motivation is to reduce disease burden, reduce the suffering of people and their loved ones. Will there be a financial payback in terms of reducing healthcare spending in future? It will be good if this comes about, but it is too early to give a realistic estimate. Because any impact in the health of people wouldn't happen immediately. The impact will perhaps be discernible 8 or 10 years down the road.
Enrollment for Healthier SG will begin next year, starting with those aged 60 and above. They are encouraged to choose and enroll with a family doctor who will support their health needs throughout their lives.
18 MPs raised questions on the Healthier SG initiative in Parliament, even as they expressed their support for it. Having adequate manpower and helping GPs put in place proper IT systems were among some of the concerns.
There are clinics who open only half a day on certain days of the week. Many do not operate on weekend and public holidays. What will happen to patients who require medical care when their GP clinic is closed? What is the contingency plan if GPs will be away for extended period of time, be it professional or for their personal reason?
What are the number of doctors, nurses and other healthcare professionals now and projected in the next decade? How does MOH intend to reach those numbers? Would it be via increase in enrollment in relevant courses in our universities, polytechnics and other training centres? If so, what is the planned enrollment for these courses in the next decade?
Going forward, inputting data and maintaining the IT system in a clinic will need more manpower and IT knowledge, particularly to ensure a high level of cybersecurity. While MOH has stated that it will support the GPs in this aspect, what will happen if a patient's preferred GP chooses not to join the network due to the clinic's constraints?
Family doctors and particularly solo practitioners operate in the heart of our communities, but are also beset by increasing costs, such as increasing rent and higher utilities bills. I would like to ask if the situation is being monitored to see if extra support or grants are needed. This is especially important if we are trying to attract more doctors to provide primary care.
Accessibility to healthcare for the elderly was another concern that came up.
For the elderly who are less mobile or immobile, regular visits to the doctor may be challenging. How does MOH intend to engage and support them? During the COVID-19 pandemic, I was encouraged by the efforts on the ground to visit the elderly who are less mobile to provide vaccinations for them. I hope that similar efforts may be made to engage and support them.
More MPs are expected to continue the debate when Parliament sits tomorrow.